Health. From Wikipedia, the free encyclopedia. This article is about the human condition. For other uses, see health disambiguation. Health is a state of physical, mental, and social well-being in which disease and infirmity are absent. History. The meaning of health has evolved over time. In keeping with the biomedical perspective, early definitions of health focused on the theme of the body's ability to function. Health was seen as a state of normal function that could be disrupted from time to time by disease. An example of such a definition of health is a state characterized by anatomic, psychologic, and psychological integrity, ability to perform personal, valued, family, work, and community roles, ability to deal with physical, biological, psychological, and social stress. Then in 1948, in a radical departure from previous definitions, the World Health Organization (WHO) proposed a definition that aimed higher, linking health to well-being in terms of physical, mental, and social well-being, and not merely the absence of disease and infirmity. Although this definition was welcomed by some as being innovative, it was also criticized as being vague, excessively broad, and was not construed as measurable. For a long time, it was set aside as an impractical idea, and most uncut in and most discussions of health returned to the practicality of the biomedical model. Just as there was a shift from viewing disease as a state to thinking of it as a process, the same shift happened in definitions of health. Again, the HWO played a leading role when it fostered the development of the health promotion movement in the 1980s. This brought in a new conception of health, not as a state, but in dynamic terms of resiliency. In other words, as a resource for living. 1984, HWO revised the definition of health, defined in as the extent to which an individual group is able to realize aspirations and satisfy needs and to change or cope with the environment. Health is a resource for everyday life, not the objective of living. It is a perspective concept emphasizing social and personal resources as well as physical capabilities. Thus, health referred to the ability to maintain homeostasis and recover from insults. Mental, intellectual, emotional, and social health refer to a person's ability to handle stress, to acquire skills, to maintain relationships, all of which form resources for resiliency and independent living. This opens up many possibilities for how to be taught, strengthened, and learned. Since the late 1970s, the Federal Healthy People Initiative have been a visible component of the United States approach to improving population health. In each decade, a new version of Healthy People is issued, featuring updated goals and identifying topic areas and quantifiable objectives for health improvement during the succeeding 10 years, with assessment at that point of progress or lack thereof. Progress has been limited to many objectives, leading to concerns about the effectiveness of healthy people in shaping outcomes in the context of a decen- dec- decentralized, decen- decentralized and uncoordinated U.S. health system. Healthy People 2020 gives more prominence to health promotion, and preventive approaches, and has a subjective focus on the importance of addressing social determinants of health. A new expanded digital interface facilitates use and dissemination rather than bulky printed books as produced in the past. The impact of these changes to healthy people will be determined in the coming years. Systematic abilities to prevent or cure health problems and promote good health in humans are undertaken by health care providers. Applications with regard to animal health are covered by the veterinary sciences. The term healthy is also widely used in the context of many types of non-living organizations and their impacts for the benefit of humans, such as in the sense of healthy communities, healthy cities, or healthy environments. In addition to healthcare interventions and a person's surroundings, a number of other factors are known to influence the health status of individuals, including their background, lifestyle, and economic, social conditions and spirituality. These are referred to as determinants of health. Studies have shown that high levels of stress can affect human health. In the first decade of the 21st century, the conceptualization of health as an ability to open the door for self-assessments to become the main indicators to judge the performance of efforts aimed at improving human health. It also created the opportunity for every person to feel healthy even in the presence of multiple chronic diseases or a terminal condition, and for the re-examination of determinants of health away from the traditional approach that focuses on the reduction of the prevalence of disease. And hopefully this did not mess up my recording. And I am speaking now when I should be reading. Distractions. Determinants. See also social determinants of health and risk factor. Generally, the context in which an individual lives is of great importance for both his health status and quality of their life. In it is increasingly recognized that health is maintained and improved not only through the advancement and application of health science, but also through the efforts and intelligent lifestyle choices of the individual and society. According to the World Health Organization, the main determinants of health include the social and economic environment, the physical environment, and the person's individual characteristics and behaviors. More specifically, key factors that have been found to influence whether people are healthy or unhealthy, including the following: income and social status, social support networks, education and literacy, employment, working conditions, social environments, physical environments, personal health practices and coping skills, healthy child development, biology and genetics, healthcare services, gender, culture, as an increasing number of studies and reports from different organizations and contexts examine the linkages between health and different factors, including lifestyles, environments, health care organization, and health policy. One specific health policy brought into many countries in recent years was the introduction of the sugar tax. Beverages taxes came into light with increasing concerns about obesity, particularly among youth. Sugar-sweetened beverages have become a target of anti-obesity initiatives with increasing evidence of their link to obesity, such as the 1974 Lalonde report from Canada, the Alameda County study in California, and the series of World Health Reports of the World Health Organization, which focuses on global health issues, including access to healthcare and improving public health outcomes, especially in developing countries. The concept of the health field as distinct from medical care emerged from the Lalonde report from Canada. The report identified three interdependent fields as key determinants of an individual's health. These are lifestyle, the aggregation of personal decisions, i.e., for I believe example, over which the individual has control that can be said to contribute to or cause illness or disease. Environmental, all matters related to health external to the human body and over which the individual has little or no control. Biomedical, all aspects of health, physical and mental develop within the human body as influenced by genetic makeup. The in, the maintenance and promotion of health is achieved through different combination of physical, mental, and social well-being, together sometimes referred to as the health triangle. The WHO's 1986 Ottawa Charter for Health Promotion further stated that health is not just a state, but also a resource for everyday life, not the objective of living. Health is a positive concept emphasizing social and personal resources as well as physical capabilities, focusing more on lifestyle issues and their relationships with functional health. Data from the Alameda County study suggested that people can improve their health via exercise, enough sleep, spending time in nature, maintaining a healthy body weight, limiting alcohol use, and avoiding smoking. Health and illness can coexist, as even people with multiple chronic diseases or terminal illnesses can consider themselves healthy. The environment is also cited as an important factor influencing the health status of individuals. These includes characteristics of the natural environment, the built environment, and the social environment. Factors such as clean water and air, adequate housing, and safe communities and roads all have been found to contribute to good health, especially to the health of infants and children. Some studies have shown that a lack of neighborhood recreational spaces, including natural environment, leads to lower levels of personal satisfaction and higher levels of obesity, linked to lower overall health and well-being. It has been demonstrated that increased time spent in natural environments is associated with improved self-reported health, suggesting that the positive health benefits of natural space is in urban neighborhoods should be taken into account in public policy and land use. Genetics or inherited traits from parents also play a role in determining the health status of individuals and populations. This can encompass both the predisposition to certain diseases and health conditions, as well as the habits and behaviors individuals develop through the lifestyle of their families. For example, genetics may play a role in the manner in which people can cope with stress, either mental, emotional, or physical. For example, obesity is a significant problem in the United States that contributes to bad health, mental health, and causes stress in the lives of a great number of people. One difficulty is the issue raised by the debate over the related strengths of genetics and other factors. Interactions between genetics and environment may be of particular importance. Potential issues. This section has an unclear citation style. The references used may be made clearer with a different or consistent style of citation and footnoting. March 2014, learn how and when to remove this template message. A number of types of health issues are common around the globe. Disease is one of the most common. According to the globalissues.org, approximately 36 million people die each year from non-communicable, not contagious disease, including cardiovascular disease, cancer, diabetes, and chronic lung disease. Shaya 2014. That's SHAH, 2014. Among communicable diseases, both viral and bacterial, AIDS, HIV, tuberculosis, and malaria are the most common, causing millions of deaths every year. Shea 2014. Another health issue that causes death or contributes to other health problems is malnutrition, especially among children. One of the groups malnutrition affects most in young children. Approximately 7.5 million children under the age of 5 die from malnutrition, and usually brought on by not having the money to find or make food. Shea 2014. Bodily injuries are also a common health issue worldwide. These injuries include broken bones, fractures, and burns. Can reduce a person's quality of life or can cause fatalities, including infections that resulted from the injury or the severity in injury in general. Moffett 2013. Lifestyle choices are contributing factors to poor health in many cases. These include smoking cigarettes and can also include a poor diet, whether it is overeating or an overly constructive diet. Inactivity and also contribute to health issues. Inactivity can also contribute to health issues, and also a lack of sleep, excessive alcohol consumption, and neglect of oral hygiene. Moffett 2013. There are also genetic disorders that are inherited by the person and can vary in how much they affect the person and when they surface. Moffett 2013. Through the majority of these health issues are preventable. Though the majority of these health issues are preventable, a major contributor to global ill health is the fact that approximately 1 billion people lack access to healthcare systems. Shea 2014. Arguably the most common and harmful health issue is that a great many people do not have access to quality remedies. Mental health. Main article: mental health. The World Health Organization describes mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work pro- productively and fruitfully, and is able to make a contribution to his or her community. Mental health is not just the absence of mental illness. Mental illness is cons- described as the spectrum of cognitive, emotional, and behavioral conditions that interfere with social and emotional well-being in the lives and productivity of people. Having a mental illness can seriously impair temporarily or permanently the mental function, functioning of a person. Other terms include mental health problem, illness, disorder, dysfunction. Roughly one-fifth of all adults 18 and over in the U.S. are considered diagnosable with mental illness. Mental illnesses are the leading cause of disability in the U.S. and Canada. Examples include schizophrenia, ADHD, major depressive disorder, bipolar disorder, anxiety disorder, post-traumatic stress disorder, and autism. Many factors contribute to mental health problems, including biological factors such as genes or brain chemistry, life experiences such as trauma or abuse, family history, or mental health problems. Maintaining. Achieving and maintaining health is an ongoing process shaped by both the evolution of healthcare knowledge and practices as well as personal strategies and organized interventions for staying healthy. Diet. Main articles: healthy diet and human nutrition. An important way to maintain your personal health is to have a healthy diet. A healthy diet includes a variety of plant-based and animal-based foods that provide nutrients to your body. Such nutrients give you energy and keep your body running. Nutrients help and build and strengthen bones, muscles, and tendons, and also regulate body processes. Blood pressure. The food guide pyramid is a pyramid shaped guide of healthy foods divided into sections. Each section shows the recommended intake for each food group. Example: protein, fat, carbohydrates, and sugars. Making healthy food choices is important because they can lower your risk of heart disease, developing some types of cancer, and it will contribute to maintaining a healthy weight. The Mediterranean diet is commonly associated with health promoting effects due to the fact that it contains some bioactive compounds like phenolic compounds, isoprenoids, and alkaloids. Exercise. Main article: exercise. Physical exercise enhances or maintains physical fitness and overall health and wellness. It strengthens muscles and improves the cardiovascular system, according to the National Institutes of Health. These are four. There are four types of exercise: endurance, strength, flexibility, and balance. Sleep. Main article: sleep and sleep deprivation. Sleep is an emotional component to maintaining health. In children, sleep is also vital for growth and development. Ongoing sleep deprivation has been linked to an increased risk for some chronic health problems. In addition, sleep deprivation has been shown to correlate with both increased susceptibility to illness and slower recovery times from illness. In one study, people with chronic insufficient sleep set as 6 hours of sleep at night or less were found to be four times more likely to catch a cold compared to those who reported sleeping for 7 hours or more at night due to the role of sleep in regulating metabolism. So insufficient sleep may also play a role in weight gain or conversely in impending weight loss. Additionally, in 2007, the International Agency for Research on Cancer, which is the cancer research agency for the World Health Organization, declared that shift work involves circadian disruption, and disruption is probably carcinogenic carcinogenic to humans, speaking to the dangers of long-term nighttime work due to its intrusion on sleep. In 2015, the National Sleep Foundation released an updated recommendations for sleep duration requirements based on age and concluded that individuals who habitually sleep outside the normal range may be exhibiting signs of symptoms of serious health problems, or if done violationally may be compromising their health and well-being. Age and condition, sleep needs. Newborns 0 through 3 months, 14 to 17 hours. Infants 4 through 11 months, 12 to 15 hours. Toddlers 1 through 2 hours. Wait, toddlers 1 through 2 years, 11 to 14 hours. Preschoolers 3 through 5 years, 10 to 13 hours. School aged children 6 through 13 years, 9 to 11 hours. Teenagers 14 through 17 years, 8 to 10 hours. Adults 18 through 64 years, 7 to 9 hours. Older adults 65 years and over, 7 to 8 hours. Role of science. Main articles: Health Science and Healthcare. Health science is the branch of science focused on health. There are two main approaches to health science: the study and research of the body and health-related issues to understand how humans and animals function, and the application of that knowledge to improve health and to prevent and cure diseases and other physical and mental impairments. The science builds on many subfields, including biology, biochemistry, physics, epidemiology, epidemiology, pharmacology, medical sociology. Applied health sciences endeavor to better understand and improve human health through applications in areas such as health education, biomedical engineering, biotechnology, and public health. Organized interventions to improve health based on the principles and procedures developed through the health sciences are provided by practitioners trained in medicine, nursing, nutrition, pharmacy, social work, psychology, occupational therapy, physical therapy, and other healthcare professions. Clinical practitioners focus mainly on the health of individuals, while public health practitioners consider the overall health of communities and populations. Workplace wellness programs are increasingly adopted by companies for their value in improving the health and well-being of their employees, as are school health services in order to improve the health and well-being of children. Role of public health. Main article public health. See also global health. Public health has been increased as the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organization, and public and private communities and individuals. It is concerned with threats to the overall health of a community based on population health analysis. The population in question can be as small as a handful of people or as large as all the inhabitants of several continents. For instance, in the case of a pan- pandemic, pandemic, public health has many subfields, but typically includes the interdisciplinary categories of epidemiology, biostatistics and health services, environmental health, community health, behavioral health, and occupational health are also important areas of public health. The focus of public health interventions is to prevent and manage diseases and injuries and other health conditions through surveillance of cases and the promotion of healthy behavior communities and an aspect relevant to human health environments. Its aim is to prevent health problems from happening or reoccurring by implementing educational programs, developing policies, administering services, and conducting research. In many cases, treating a disease or controlling a pathogen can be vital to preventing it in others, such as during an outbreak. Vaccination programs and distribution of condoms to prevent the spread of uncommunicable diseases are examples of common preventive public health measures, as are educational campaigns to promote vaccination and the use of condoms, including overcoming resistance to such. Public health also takes various actions to limit the health disparities between different areas of the country and in country and in some cases the continent or world. One use is the access of individuals and communities to healthcare in terms of financial and geographical or so social so so color sociocultural constraints. Applications of the public health system include the areas of maternal and child health services administration, emergency response, and prevention and control of infections, infectious and chronic diseases. The great positive impact of public health programs is widely acknowledged due in part to the policies and actions developed through public health. The 20th century registration and decrease in the mortality rate for infants and children, and a continual increase in life expectancy in most parts of the world. For example, it is estimated that life expectancy has increased for Americans by 30 years since 1900, and worldwide by 6 years since 1990. Self-care strategies. Main article self-care. See also chronic care management, social relation, and stress management. Personal health depends partially on the active, passive, and assisted cues people observe and adopt about their own health. These include personal actions preventing or minimizing the effects of a disease, usually a chronic condition, through integrative care. They also include personal hygiene practices to prevent infection and illness, such as bathing and washing hands with soap, brushing and flossing teeth, storing, preparing, and handling food safely, and many others. The information gleaned from personal observations of daily living, such as about sleep patterns, exercise behavior, nutritional intake, and environmental features, may be used to inform personal decisions and actions. E.g., I feel tired in the morning, so I am going to try sleep being on a different pillow, as well as clinical decisions and treatment plans. E.g., a patient who notices his or her shoes are tighter than usual may be having exacerbation of self-cited heart failure and may require diuretic medication to reduce fluid overload. Personal health also depends partially on the social structure of a person's life. The maintenance of strong social relationships, volunteering, and other social activities have been linked to positive mental health and also increased longevity. Long, longevity. One American study among seniors over age 70 found that frequent volunteering was associated with reduced risk of dying compared with other persons who do not volunteer, regardless of physical health status. Another study from Singapore reported that volunteering retirees had significantly better cognitive performance scores, fewer depressive symptoms, and better mental well-being and life satisfying than non-volunteering retirees. Prolonged psychological stress may negatively impact health and has been cited as a factor in cognitive impairment with aging, depressive illness, and expression of disease. Stress management is the application of methods to either reduce stress or increase tolerance to stress. Relaxation techniques are physical methods used to relieve stress. Psychological methods include cognitive therapy, meditation, and positive thinking, which work by reducing response to stress. Improved Improving relative skills such as improving health as problem solving and time management skills reduces uncertainty and builds confidence, which also reduces the reaction to stress causing situations where those skills are applicable. Occupational main article: occupational safety and health. In addition to safety risks, many jobs also present risks of disease, risks of disease, illness, and other long-term health problems. Among the most common occupational diseases are various forms of pneumoconisis, including sclerosis and co-workers pneumoconiosis, black lung disease. Asthma is another respiratory illness that many workers are vulnerable to. Workers may also be vulnerable to skin diseases, including eczema, dermatitis, urticaria, sunburn, and skin cancer. Other occupational diseases of concern include carpal tunnel syndrome and lead poisoning. As the number of service sector jobs has risen in developed countries, more and more jobs have become sedentary, presenting a different array of health problems that those associated with manufacturing and the primary sector. Contemporary problems such as the growing rate of obesity and issues relating to stress and overwork in many countries have further complicated the interaction between work and health. Many environments view occupational health as a social challenge and have formed public organizations to ensure the health and safety of workers. Examples of these include the British Health and Safety Executive and in the United States, the National Institute for Occupational Safety and Health, which conducts research on occupational health and safety, in the Occupational Safety and Health Administration, which handles regulation and policy relating to worker safety and health. And this is health from Wikipedia, the free encyclopedia.